Hello everyone, my name is Saloni and I am a physiotherapist. If you are someone who is preparing for the NEET entrance exam, if you are someone who wants to pursue physiotherapy as a career, or if someone close to you is thinking of doing so, or simply if you want to know more about what physiotherapy is, then this video is for you. In this video, we are going to talk about what is physiotherapy, how to become a physiotherapist, what is the 4-year syllabus of the UG Physiotherapy course, and the future scope of physiotherapy. Now let's start with what is physiotherapy. Now physiotherapy is very difficult to define in a few words or few sentences, but if I was to explain to you in general terms, then it is a science that deals with rehabilitation of people in order to decrease the impact of deformity, in order to improve the quality of life of people without the use of external medications and with the use of exercises, modalities and say some form of manual therapy to improve their general functioning and to improve their quality of life. Giving you an example, I would say that, say for example, someone has suffered a fracture. Following a fracture, the part has to be immobilized for some time in order for the fracture to heal. So during this immobilization, a lot of complications may arise, such as there is a decrease in the strength of the muscles surrounding the fracture area. There is a decrease in the range of motion of the joint. So that is when a physiotherapist steps in and does the function of improving the strength of the affected muscles, improving the range of motion of the joint. Say for example, someone wants to pursue fitness, but they don't know what exercises to follow, what protocol to follow in order to do that. So that is when a physiotherapist steps in and does a thorough assessment of the patient, and based on the assessment prescribes certain exercises, prescribes certain protocols, types of exercises to the patient in order for them to benefit and to become fit. Coming to the question of how to become a physiotherapist. So here in India, if you want to become a physiotherapist, you have to start the process 2 years earlier. That is, you have to prepare for an entrance exam called as the NEET UG exam. For this exam, you have 3 subjects: physics, chemistry and biology. So to give this exam, you have to study these subjects for 2 years, that is your 11th and the 12th standard. The reference textbook for this is the NCERT book. So for 2 years you will prepare for this exam, then you will give this exam. So you have cleared the NEET UG exam. So what do you do now? Here you have 3 options. Either you can go for a government college. So government colleges receive aid from the government, due to which the fees here are very lower compared to the other colleges. But the seats here are limited in number. Also, a lot of patients come to seek treatment in these hospitals. So you will get a lot of patient exposure in such hospitals. The next one is a private hospital. So say you don't get into a government college, so you can go for a private college. So in these colleges, the fees are a little higher compared to those of government colleges, but the number of seats would definitely be more than those of government colleges. But the number of patients coming in here will depend upon the location and the reputation of the college. There is a third option called as deemed universities. So the previous two, that is the government and private colleges, are affiliated with the state health university. So for example, the state of Maharashtra has a Maharashtra University of Health Sciences. So in such way, all the states have their health science universities. But in case of deemed universities, they have their own university. So they don't follow the rules of the state university. So that is the difference of deemed colleges. Also, the fees here would definitely be more than those of government or private colleges. The number of seats would differ depending on college to college, and the patients coming here would also depend upon the location and the reputation of the college. I'm sure many of you who are interested in physiotherapy would like to know what are the subjects that we study. So here I will tell you a breakdown of all the 4 years of physiotherapy academic curriculum and explain to you in short, in brief, about each subject. So physiotherapy is a 4.5-year course, of which the first 4 years are purely academic. So every year you have to study, you have to give exams and pass those exams in order to go for the next year. So in this way you complete 4 years of education, after which once you clear your final year exams, you will start internship. So this internship period lasts for 6 months. So 4 years of academic curriculum and then 6 months of internship. During your internship, you will go to your college OPDs, or you may be posted in some other external hospitals associated with your college, where you have to go and look, see and treat the patients or the people coming in these OPDs or such healthcare centers associated with your college. Every year you have 2 types of subjects. One is called as medical or external subjects, and the other are called as physiotherapy or internal subjects. So what is the difference between the two? So external or medical subjects are the subjects that are common to all the medical students. So for example, these subjects would be studied by other medical students of MBBS, BDS and so on. But pure physiotherapy subjects are the subjects studied only by physiotherapy students. Coming to the first year. So in first year, you will have 3 medical subjects and 2 physiotherapy subjects. Of the medical subjects, first one is anatomy. So now, as most of us would be aware, anatomy is the study of the physical body. So for example, this includes the structure of each and every bone in your body, the structure and the origin insertion of the various muscles of the body, the course of the nerves in the body, and so on and so forth. So all these studies, all these things are included in anatomy. The next subject is physiology. So physiology deals with the functioning of the various organ systems of the body. Say for example, your endocrine system. Various hormones are being released into your bloodstream at regular intervals, but you are not aware of these. Where do these hormones come from? Where are they produced? Where do they act in your body? This is just an example of what we study in physiology. Various other systems like the nervous system, the gastrointestinal systems and so on are studied in physiology. The third subject is called biochemistry. So biochemistry is the study or the chemistry of the various biological elements of the body or various biological elements of nature. So in this subject you would study about, say, the chemical structure of DNA, or say the chemical structure of various food products, such as the chemical structures of glucose, ribose, other types of starch and so on. Coming to the physiotherapy subjects. So in first year you will have 2 physiotherapy subjects. The first one is called as fundamentals of kinesiotherapy and kinesiology. So these are 2 different subjects combined in one. So kinesiology, for example, is the study of the various functioning or the motions that take place in the joints of the body. That is called as kinesiology. In kinesiotherapy, you deal with the understanding or the treatment of any impairment of the human body. So for example, any joint or any muscle is impaired. So how do you treat that? With the use of exercise, with the use of various manipulations is what is learned in kinesiotherapy. So in first year you will learn only the fundamentals of these 2 subjects. The next subject is called fundamentals of electrotherapy. Now electrotherapy would be a new concept for you, but in physiotherapy we use few modalities in order to relieve the pain of the patient. These modalities are nothing but these are machines that do certain functions so as to reduce the pain of the patient. Coming to the second year. So in second year you have 4 medical and 3 internal subjects. So of the medical subjects, the first one is called as pharmacology. As the name rings a bell, pharmacology is basically the study of drugs or medicines in general. So in this you study about the various types of drugs, how these act on your body, how they perform their required action, what are the receptors that they act on in order to produce this action. That is the basics of what you will study in pharmacology. As a physiotherapist, it is important to know about the various drugs that a patient coming to you might be consuming. So that is the reason of studying pharmacology. The next subject is microbiology. So microbiology is the study of microbes. There are various microorganisms in the environment that may be good or bad for human beings. There are various microorganisms that are responsible for certain diseases, not just microorganisms, various parasites, various fungi are also responsible for certain diseases caused in human beings. So microbiology is basically the study of this. The next subject is pathology. So anything wrong going on in your body is called as patho, that is pathology. So say for example, there is an ulcer developing in your body. So that is not the normal functioning of your body, that is something abnormal going on. So it is called as pathology. Okay, so the study of all these abnormal things that could happen in a body is known as pathology. For example, say you have a fracture, how the fracture happens, what are the things that go on in your body when you have a fracture, how the fracture heals. Say for example, you have a cut, there is inflammation, there is edema, the various things that could go on when such things happen is the study of pathology. Coming to the next subject, it is called as psychiatry and psychology. Although they sound familiar, these are two different aspects or two different subjects combined as one. So in psychology, you study about the behavior of organisms. For example, why a certain organism behaves in a certain way, in a certain situation. That is a gist of what psychology is. Coming to psychiatry, it is a more defined term in which it is a more defined subject in which you deal with the various psychiatric illnesses that could happen to a person. So there are a lot of types of disorders, psychiatric disorders. Say for example, mood disorders, say depression, bipolar disorder. These are certain types of mood disorders. There are also various types of eating disorders. So all these types of psychiatric illnesses that could happen to a person are included in psychiatry. So here you understand what the disease is, why it could happen to a certain population, what could you do in order to treat them. A lot of patients coming to you may have such underlying illnesses. So it is important even as a physiotherapist to identify these disorders if not done previously, and if they are previously diagnosed, then doing such a treatment so as to not disturb these disorders is important as a physiotherapist. So that is the reason for us to study these subjects. Coming to the internal subjects, there are three internal subjects, the first of which is kinesiology. So as I explained previously, kinesiology is the study of various forces, the various motions that happen in a joint, in a moving joint. So in this you study in very detail each and every joint of the human body. You understand in which motion happens at the joint during a particular movement that you perform. Say for example, what happens in your shoulder joint when you perform a flexion movement, what happens to the joint when you perform an extension movement. All of this is studied in very detail in the subject called kinesiology. The next subject is called kinesiotherapy. So as I told you previously, kinesiotherapy is deals with the treatment part. What is the therapy that you would give in a person with some form of impairment that comes to you. So there are various forms of therapies that are available. Say for example, there is something called as hydrotherapy, in which we use water in order to treat the patient, in order to make the patient better. There are also various other things called as mobilizations, manipulations that we use in order to reduce the pain and make a joint or a movement pain free and in a right direction. So all these things would be studied in kinesiotherapy. So another subject is electrotherapy. As you studied in first year, you would have a more detailed understanding of the various types of machine that we use, the types of modalities that we use in treatment of a patient. You would understand the mechanism and working of each and every machine. You would understand the indications, contraindications of such machines. So all this detailed study is included in electrotherapy. Coming to the subjects of third year physiotherapy. So here you have 5 + 2 external subjects and 1 internal subject. Coming to the external subjects, so there are 2 major subjects called as surgery and medicine, but both of them are divided into 2 parts. So you will have surgery 1, surgery 2, medicine 1, medicine 2 as the 4 major external subjects, and there are other external subjects that I will be coming to. So coming to surgery 1. So any surgery taking place in your body that comes under general surgery is included in surgery 1. So for example, you had a thoracotomy. The procedure for that, the complications, how physiotherapy would help in such a condition, all that would be included in surgery 1. Surgery 2 is purely ortho, that is any orthopedic conditions. For example, fractures of the various bones of the body, bony deformities that are present in the body, any congenital deformities that occur, all this would be included in orthopedics. Coming to medicine. So medicine, as the name suggests, we study about the various medical conditions. Here also you have medicine 1 and medicine 2. So medicine 1 is general medicine, that is all the conditions of say respiratory tract, genitourinary tract, gastrointestinal tract, all these systems are included in medicine 1. All systems except neurological system, the nervous system is included in medicine 1. Okay, so now where would the neurological system go? It comes in medicine 2. So medicine 2 is a subject made of only 2 major systems. One would be the adult neurological system and second is pediatrics. So these 2 major things make up medicine 2. Any neurological condition, say for example Parkinson's, for example any nerve palsy, nerve injury comes in medicine 2. So other than that, there are a lot of conditions that occur predominantly, most commonly in pediatric population. For example, there are congenital heart diseases, there are conditions like hydrocephalus that are more common in children. So all these conditions are studied in medicine 2. The next subject would be PSM, that is abbreviated for preventive social medicine. So many a times we diagnose diseases and look at the medical aspect of the diseases, but there is also a social aspect for every patient and every disease. We also have to look at the socioeconomic status of the patient that is coming to us. We also have to see the environment that the patient lives in. These things, that is the social aspect of medicine, is included in preventive social medicine. Coming to the other 2 subjects, these subjects are graded subjects. That means these exams will happen at the college level and you have to pass these exams in order to qualify for the university exams. So the first subject is dermatology. As the name suggests, this is the study of the various conditions that occur to the skin. So for example, conditions like psoriasis, any kind of ulcers, any kind of dermatitis is included. The study of this is included in dermatology. The second subject is called as gynecology and obstetrics. So here we study about the various conditions that could occur in women and in pregnant women. So for example, say there are conditions like PCOD that occur, why it occurs, how it impacts the daily living of the particular woman. Then obstetric conditions, there are various conditions that occur with pregnancy. For example, preeclampsia, such conditions are important to know as a physiotherapist. So all these things are included in the subject of gynecology and obstetrics. Coming to the internal subject, you have only one internal subject for third year, that is called as FDPS, abbreviated for Functional Diagnosis and Physiotherapeutic Skills. So what do you do in this subject? So third year basically is all about assessment and forming a diagnosis. So for example, a patient comes to you, he most often has a medically diagnosed condition, but a medical diagnosis is different from a functional diagnosis. So what is a functional diagnosis? Here we understand the functioning of the patient. What are the functions he can perform? What are the functions that he cannot perform? All these are taken into account by conducting a very detailed and thorough assessment, and then we form a functional diagnosis. All this requires physiotherapeutic skills, and hence the name Functional Diagnosis and Physiotherapeutic Skills, that is FDPS. Coming to the subjects of 4th year physiotherapy, so here you don't have any external subjects, you have only 4 internal subjects. Now these 4 subjects are also the main important branches of physiotherapy. So for example, in the future you decide to pursue post graduation, so you have to select one of these 4 branches to do your masters in. So what are these 4 subjects? The very first one is MSK, musculoskeletal, also called as ortho subject. So in this you study about the various muscular and skeletal conditions that occur in a patient. Say for example, there is inflammation of the tendon called tendinitis, frozen shoulder, osteoarthritis. So all these conditions are included in MSK. Coming to the second subject, that is called as neuro. So as the name suggests, it consists of study of all the neurological conditions. For example, someone has Parkinson's disease, GBS, MS, so all these conditions are included in neuro. The third subject would be cardiorespiratory conditions such as heart failure, hypertension, respiratory conditions like bronchiectasis, bronchial asthma, all these are included in cardiorespiratory. And the last subject is called as CBR, that is community based rehabilitation. Now this is an umbrella term for a lot of subtopics or sub-subjects that are included in this community. For example, there is geriatrics, which deals with the rehabilitation of old aged people. There is women's health that deals with the rehabilitation of pregnant women or any women suffering from any gynecological or obstetric problems. Then there are other aspects such as industrial, which deals with rehabilitation of people that have certain disorder or diseases that are caused as a result of trauma at their workplace. So for example, a person is doing a typing job for a long time. There is a lot of strain on their fingers, on their wrists, that could lead to a lot of overuse diseases, overuse disorders. So all these conditions are included in industrial rehabilitation. So this is a subset, these are subsets for the major topic called as community based rehab. While 3rd year is all about assessment and forming a functional diagnosis, 4th year is all about treatment. So whatever the diagnosis you reach on in your 3rd year, you have to apply physiotherapeutic treatment to all that conditions when you come in the 4th year. So in the 4th year, you learn about the treatment of various conditions, various disorders that could happen to a person. Coming to the last part of the video, that is, what is the future scope of physiotherapy? So I'm sure if you have told anybody that you are a physiotherapist, or if you are thinking of pursuing physiotherapy, then they would have definitely told you, oh, it's a very happening field, there is a lot of scope in this field. But is it so? If that was the case, then all the physiotherapists would have a lot of money, they would all lead a luxurious life. But in reality, there are a lot of people who are struggling even to find a decent job with a decent pay. So why is that so? So what are these skills that a physiotherapist must possess in order to become a very good physiotherapist and in order to become successful? Here I will list 3 important aspects that make someone a good physiotherapist. The very first and the very basic is interest. So a lot of students pursue physiotherapy just because they did not get a seat in MBBS college, but that is okay, that was the past. But now you have to move on and live in the present. Now that you have chosen to become a physiotherapist, learn to become one, learn to love what you are doing. You need to have interest in this subject in order to excel in the field. So for you to do that, you need to have an interest. You need to know, you need to be interested in the condition of the patients, and you need to be interested in treating them. So that is a very important aspect for somebody to become a very good physiotherapist. The next would be communication. So a lot of physiotherapists are good doctors, they have a lot of knowledge, they know what to do in certain conditions, but the problem is that they cannot communicate that to the patient. Every patient coming to you is expecting to get better by your care, and you have to be good enough to live up to their expectations and give them the results that they are expecting. So in order for you to do that, it is very important for you to form a rapport with that patient. Third is intention. It is very important what your intention is when you treat a patient. There are a lot of therapists who only care about, it is sad but it is true that a lot of physiotherapists only care about the money that comes in by treating a patient. So whenever a patient comes to them, all they are seeing is how much am I going to get paid by this patient. In the process of doing this, they forget that someone coming to them is also a person, is also someone's family, and is also a human being trying to become better in their daily function. So whenever a patient comes to you, it is very important to know that your role is to function, is to improve the function of the patient, is to give the patient a better quality of life than he is living currently. A lot of physiotherapists are driven by the ambition of becoming rich, and they forget to treat the patient as a human, and so because of this they focus only on that particular session. Okay, I will give 10 exercises today and I will get this much money. The next session would be the same, but they forget to make improvements. They forget to see if the patient is actually getting better, if the patient is actually improving in their care, which is very important, because that is the job of a therapist, to make the patient better. So these are the 3 qualities that a physiotherapist must possess. He may be a fresher, he may be an experienced doctor, but these are the 3 things that are very important if you want to be a physiotherapist. Now a lot of people would say that okay, I am very young to give such advice, and yeah, I agree with these people, but whatever I said, these 3 points are not made by me. We have done a lot of podcasts with a lot of famous and a lot of renowned, a lot of successful physiotherapists, and these points are derived from whatever conversations we had with them. So if you want to check out these podcasts, head on to our channel and check out these podcasts. They will help you a lot. That is the end of the video. I hope you guys liked the video. I hope this video helped you in any certain way. If you have any questions, if you have any doubts, if you want me to explain any particular aspect of this video in more detail, please let me know in the comments. Thank you so much.